All right, so we're entering swim season. We're talking pools, lakes, the ocean, really. But before you head into the water, there are some key things that you always need to be aware of to make sure that you and your kids are safe when they do so. And here to talk about water safety, Dr. Vinitha Moopen from WellSpan Family and Pediatric Medicine in Rothsville. Good morning, Dr. Moopen. How's it going? You doing all right?
Good, thanks.
So yeah, we're talking summer vacation. I just got back from one. Of course, we're around the water. What do you say to families when we're talking about water safety in regards to drowning?
So just make sure, as early as you can to get those swim lessons in. You want to have the kids at least know safety and how to keep themselves afloat while they're in any body of water. So that would be the key, is not to depend on floaties and those bubble things. Just have them learn that as soon as they can.
It's a life skill, really,
yes.
And one that they'll carry with them throughout the rest of their life. So let's talk about something that I've heard about this. I don't know exactly what it is. Dry drowning.
So dry drowning is when water gets into the nose or the mouth, and then it causes the vocal cords to just kind of snap closed. And so there's no air going into the lungs. It can lead to, respiratory issues, respiratory failure. And the thing to remember is that it can happen for hours after the event.
So like even if they seem okay, you should keep an eye on them.
Yes, and not take them to the pediatrician's office, but take them to the emergency department so they can be monitored.
So are we saying like it would happen an hour later, or is it like a slow process?
It can be a slow process. Sometimes you see the effects immediately, but sometimes it takes up to 24 hours to see the effects.
Okay.
Yeah.
All right. So obviously drowning, top thing. A lot of people are very concerned about that, but there are other issues that can come along.
Yep.
Talking about things like ear infections, water getting in the ear.
Right. So that's mainly the external ear. So like swimmer's ear, water gets in, and bacteria and fungi kind of do their thing, and you get discharge and pain. So one way to prevent that would be to use earplugs or a nice swim cap that covers your ear. Make sure when you take those earplugs out that you're cleaning it with alcohol and letting it dry for the night. But that would be one way to prevent that.
What's some of the signs that a parent should watch out for?
So pain, discharge are the main ones.
Okay.
And then usually ear drops are your treatment for that.
Okay, so if you see your kid acting a little fussy after playing in the
Right.
water, that could be it.
Yep.
All right, now I got to ask about this because obviously I'm sure most people at home know all about it. Your mom tells you got to wait 30 minutes before you go into the water after eating. Is this a thing?
No.
It's not a thing. Mom, if you're at home.
So I grew up in Florida, and we follow that because that's what our mom said.
Yeah.
But it's not scientifically proven.
Okay,
So,
there you go. All right, Dr. Moopen, thank you so much for spending some time with us. Look, if your child needs to be seen by a doctor at WellSpan, we have information on how to make an appointment right now on our website, fox43.com. Dr. Moopen, thanks again.
Absolutely.